Good morning and hello everyone. Today I shall discuss the role of pumpkin seed extract and oil in the treatment of hair loss. As all treatment should be carried out under the guidance of Ayurveda. The hair loss is a common problem occurring both in males and females, and it poses an important psychological burden. The term alopecia means partial or complete hair loss in over the scalp, a part of the skull, and it should be understood that normal hair loss is about 50 to 100 strands per day. There are two types, the scarring type and the non-scarring type. Non-scarring types, the common subtypes or types include telogen effluvium, androgenic alopecia, alopecia areata, and tinea capitis. Androgenic alopecia occurs both men and women. Scarring alopecia is rather uncommon but can occur with lichen planus, hair injury or scalp injury, and scalp infections. The important causes are endocrine causes, hypothyroidism or hyperthyroidism, fungal infections, the systemic diseases, systemic lupus erythematosus, secondary syphilis, and many drugs used for different purposes cause hair loss, mostly telogen effluvium. And the most important are anti-cancer drugs, warfarin, heparin, anti-thyroid drugs, carbimazole, vitamin A analog, isotretinoin, acitretin, lithium carbonate, some beta blockers, interferons, colchicine, sodium valproate, tacrolimus, and amphetamines. The list is quite exhaustive and different type of loss is noted. There is always a genetic susceptibility, and in particular subjects there will be excessive hair loss. Environmental factors, particularly excessive use of smoking, alcohol, and extent of air pollution all affect the. Now, normal hair growth cycle is characteristic, undergoing 3 or 4 phases. Anagen phase is the active hair growth, and that lasts for 2 to 6 years and may last for 10 years. Longer the anagen phase, thicker and denser will be the hair. Then there is a catagen phase that lasts for a short time, and the hair stops growing and follicles start shrinking. In telogen, which lasts for about 5 months, there is usually the resting follicles, and the proportion of resting follicles normally is 10% to 15%. And it is this phase that new hair start growing from the bed of the follicle. In telogen effluvium, too many hair enter into catagen phase, therefore there is a hair loss. And finally, the shrunken hair starts shredding in exogenous phase that may take 2 to 5 weeks, and the hair which are growing from below will allow to come up and become the new hair in. Characteristic features of alopecia: telogen effluvium is commoner, diffuse shredding of the normal hair, and usually reversible if appropriate diet and nutrition is done. Stress, fever, severe infection, hormonal disturbance may cause telogen effluvium. Androgenic alopecia is an important clinical condition, may occur with male and females. There is a hair loss over temples, recession of the anterior scalp line, so the shape of the hair will be M or U shaped hairline. And in males it occurs due to increased sensitivity of the affected hair follicles to androgens, and they excess androgen, particularly DHT, we will find will shorten the anagen phase. And in females, the pattern is little different. Hair loss occurs top centrally and then it spreads over front. And here there is an increased level of circulating androgens. of ovarian or adrenal glands in female, and treatment is available. Alopecia areata is the localized areas of the hair loss, and most common is immunological disturbance due to T cell dysfunction. And tinea capitis is a fungal infection causing patches of incomplete hair loss. For all these conditions, specific nutritional deficiencies also cause hair loss, particularly protein, vitamin, and mineral deficiencies. Brittle hair may occur due to biotin deficiency. Color changes may occur in zinc deficiency. Dry hair are common in vitamin A and E deficiency. And easy breakability, pluckability is seen in protein, biotin, and zinc deficiency. Coiled and cork-tissue hairs may occur vitamin A and C deficiency or due to excess use of sodium valproate. And treatment of the hair loss in general, I have tried to summarize. There is a detailed description available in the references. Stress avoidance and treatment of the stress if needed. Nutritional support must be given. Supplementation should be given. There is a role of melatonin. Drugs are available: topical oral minoxidil, topical oral finasteride, or dutasteride. For alopecia areata, baricitinib is a JAK inhibitor is available. Newer emerging therapies are coming up, particularly clascoterone is an androgen receptor inhibitor which can be used topically over scalp. Platelet-rich plasma injections is a newer mode. Hair transplantation by various modes. Mesenchymal stem cell-derived exosomes and low level of laser therapy have been tried. Even without drugs, microneedling also improves hair gain. Several plant and herbal derivatives are used, and the use is called as phytotherapy is an important emerging therapy for hair loss, and several of the extracts and oils derived from plants, Saronia repens, that is Panax ginseng, Curcuma aeruginosa, Cucurbita pepo, Trifolium pratense, palm extract, rosemary oil, caffeine extract, ashwagandha, and others are used for topically. Indian pumpkin of several varieties available, and pumpkin seeds are quite common in culinary practices, and basically it is a creeper climber, and Cucurbita pepo is common. Indian varieties are shown here, and seeds are usually large in size, green in color, but may have different hues, and the oil content is quite high in the seeds. Pumpkin pulp is also useful as a nutrient, but also contains polysaccharides, terpenoids, carotenoids, amino acids, proteins, colors, fibers. Now, seeds, peel, and flesh all are used because of their characteristic chemical content. The seeds have high fatty acid content, particularly monounsaturated and polyunsaturated fatty acids, markedly linoleic acid and linolenic acid, oleic acid. They are very commonly found. Other minerals are also found. Particularly magnesium is higher in the chemically carotenoids, flavonoids, tocopherols, phenolic derivatives. They all have antioxidant, tissue protective, anti-diabetic, anti-platelet activity, and these phenolic extracts are also used in metabolic syndrome. The nutritional medicinal value of pumpkin is because of these contents. They not only provide calories but also may act as anti-inflammatory, antioxidant, antiviral, hepatoprotective, antihypertensive, anti-diabetic agents. It is an important drug in the Unani medicine, and the maximum quantity of raw or roasted seeds which can be consumed daily is about 10 to 20 grams to a max of 28 grams per day. Now there is an experimental evidence of a number of activities, and because of that there is a clinical importance and therapeutic use of pumpkin seed extract. The type of the extracts used are phenolic extracts, acetone extracts, hydroethanolic extract, defatted pumpkin extract, water-soluble extract, and seed oil. The formulations available are pumpkin seed oil for topical as an oral capsule, and there are actually formulations found elsewhere also, but in India also some formulations are found. For example, Vedagon tablet is containing 500 milligram extract. The capsule is available online and contains equivalent to 500 milligram oil extract. Seed oil is also available alone or along with other ingredients to be taken orally, and Kushmandi tail is also marketed formulations in the form of capsule online. Water-soluble pumpkin seed extracts are also online. So a variety of them are available. Now, role in alopecia, both experimental and clinical evidence is there, although it is limited. Now, in 2019, the authors found that oil retarded testosterone induced hair loss and promoted hair growth in mice. Greece Clean Cruz also recently evaluated topical pumpkin seed oil in mice for 7 days and showed that there was an increase in the number of hair follicles. Cho et al. In 2014 in Korea actually conducted a pilot clinical study in male androgenic alopecia using 100 milligram specially formulated capsules containing PSO. 400 milligram total per day was given, and their study was conducted for 24 hours, and they found that there was a positive effect. That is an important pivotal study to show that pumpkin seed oil orally is effective. Adverse effects were not different in placebo versus PSO group. Although later a study was criticized to be overestimating the effect, but it is the first study that showed. Later, in 2021, Ibrahim also showed a 3 months trial effects of PSO versus minoxidil in the treatment of female androgenic alopecia. So there was one study for male and another study for female androgenic alopecia. The multi-ingredient formulations are usually available elsewhere, and recently a study was done with multi-ingredient formulations. Capsule, the name was Lambda Pill 5 Alpha Plus, and it was studied in 80 patients with androgenic alopecia, both male and female, and the results show that there was an improved hair volume, appearance, and reduced hair loss. There was an increased number of anagen. The recently, especially nanotechnology formulation is also made available. That is PSO-loaded neosomes for better skin penetration over head. Now, it has been found that the efficacy is more when such neosomes are used. There was a reduction in the percentage of hair fall by 44.42% in 60-second hair count experiment, and significant increase in the anagen to telogen ratio by a tricoscan technology. How does a PSO act in alopecia? The phytoesterols, polyphenols, unsaturated linoleic acid, these contribute to inhibit a key enzyme 5-alpha reductase that forms active dihydrotestosterone from testosterone. Dihydrotestosterone is a chemical considered to be responsible for androgenic alopecia Now, DHT activity either is amount or sensitivity is increased. Now, sensitivity is increased in male androgenic alopecia and levels are increased in female androgenic alopecia. When there is increased sensitivity or amount, there is a miniaturization of hair follicle, thinning of hair follicle, shortened hair growth cycle. So more remain in the static telogen phase with less speed of regrowth, and this ultimately results in hair loss. Some individuals have genetic variation, the androgenic receptor found on the hair follicle on which DHT acts, and therefore there is the greater or excessive hair follicle loss. The number of constituents have other anti-activities responsible for beneficial action, particularly antioxidant tissue protective that support hair growth and hair. In addition, PSO may also supply essential nutrition and trace elements, particularly zinc needed. So in nutshell, the mechanism is just like finasteride and dutasteride, the standard treatment for the androgenic alopecia. Pumpkin seed oil extract also inhibits the type 2 5-alpha reductase responsible for generation of dihydrotestosterone, the chemical responsible for dosing of the PSO. It can be used topically or it can be used by mouth as capsule or tablet containing 400 to 500 milligram of active ingredient. 1 to 2 tablespoons of pumpkin seed oil can also be used in cooked vegetable dish, not during cooking, but as a summary and conclusion is whether the use of pumpkin seed oil is a great hope or hype. We have no insufficient evidence. There are many factors responsible for androgenic alopecia, and unless these factors all are addressed together, the outcome of studies will always be confounding. There is a limited evidence on the efficacy of long-term use of PSO in alopecia, and often multi-ingredient formulations are used. The role of individual herbal ingredient remains to be ascertained. Efficacy in small-sized and short-term duration studies show some benefits in the form of hair growth. PSO may be considered as a natural DHT inhibitor. One who opts for use of PSO may apply it over areas of skin, over scalp, or take orally as capsule under supervision. These are the references. For greater time to know more about the drugs and herbs, you may please visit this YouTube site. Thank you.